racial and ethnic minority groups have lower measures of access than whites in terms of having a usual source of care or making visits to certain providers. We know that their access is measured by these indicators is better since reform. 88% of Blacks and 90% of Hispanics report having a usual source of care. However, individuals from racial and ethnic minority populations are more likely than whites to report that they have an unmet health need. 24% of Blacks and Hispanics compared to 21% of whites. They also are more likely to report difficulty accessing a specialist and are more likely to report making an emergency department visit for non-emergency care. But as these numbers demonstrate, disparities still exist, and as we watch federal policy on healthcare reform, we want to make sure that we maintain the progress that we have in Massachusetts and that those policies build on our efforts to eliminate disparities. As we continue to monitor the impact of reform, we want to hold ourselves accountable for making sure that we do not squander the opportunity that achieving nearly universal coverage presents to us. We must pay attention to the systems of care that we have in our state and ensure that they meet the needs of all populations, recognizing that a one-size-fits-all policy will not work. If we do not improve the way that we engage people in care, we will not eliminate disparities.